What are some of the darker effects COVID-19 has had that we don't talk about? Pediatrician. Here we have had multiple babies and toddlers brought to the hospital by police, 4 found alone in the home with carriage, either deceased. Cognitive decline, even in those who aren't infected. Lack of stimulation, excess of stress, etc. People's attention spans and memories are shot. Their reasoning ability is dimmed, self included. More depression, self-medication. People that didn't get COVID but do have ongoing health problems were less able and less likely to get the ongoing care that they would normally get. What you're seeing now is an uptick in 911 calls and visits because their conditions worsened and now have become medical emergencies. The health crisis that this pandemic caused is much farther reaching than just the people that got COVID. Source: I'm a firefighter. In my opinion, the darker effect is definitely the people with other illnesses that couldn't get treatment because of the lockdown rules. Many people couldn't get life-extending radiation treatment and are no longer around. Somehow I feel there could have been a better alternative to no treatment. The serious mental health impact and the shifted routine perceptions. I still feel like going out of the house is a dream, still in my house is reality. 30% increase in drug overdose deaths in 2020. People have become nasty as fuck for a variety of reasons. As a dental student, I see lots of people who neglected their teeth who otherwise might not have, regular cleanings, checkups, not returning for definitive treatment, and having a temp crown on for 18 months. This is partly the fault of dental offices cancelling appointments indefinitely and never rescheduling the patients, but also partly patient fear of catching COVID from other patients, etc. TL. Doctor, more people's teeth are more fucked up. Edit. As some astute observers have pointed out, some other factors include being home all day means eating more frequently, don't eat between meals, and more sugary diets. Lack of a pre-work routine means oral hygiene habits are poor, and we all are more stressed and have been clenching/grinding our teeth down to nubbins. 911 dispatcher for a small town here. The amount of domestic violence calls I have taken has skyrocketed. It's beginning to seriously drag me down and exhaust me. I also help the local programs try to get food to families with kids. I broke down when I realized some kids only get food at school. This is a bit embarrassing because I'm in my 20s, but lockdown made me develop hemorrhoids. It's common among PPL who sit a lot for their work, and because of lockdown I get less exercise, and here I'm with FCK and hemorrhoids on top of all the stress and chaos of the pandemic. Edit. RIP my inbox. Mental health. I work in mental health. It's rough out there. So many people have been getting pets that veterinarians cannot keep up. There is also a very real chance that animal shelters are going to be overloaded with abandoned pets once people stop working from home. I haven't heard a lot of people talk about it, but I had/still have survivor's guilt. The guy in recovery next to me passed away in the middle of the night. We had our hospital dinner hours before and we had a great conversation. As just before we went to sleep he said, "Hey, I really like you, man. Once we get out to here let's get actual dinner." I said absolutely, anything would be better than this stuff. Later that night, I heard his machine go off. We were blocked by curtains and heard the nurses and doctors come in and wheel him out saying to get the defibrillator. I don't remember much, but that has stuck with me, mainly because I thought I was next. I figured I'd never see my wife, family, or friends ever again, so I was trying my best to come to terms. I didn't find the peace everyone says you find near death. Anyways, after 47 days 10 in the ICU, I was able to leave. Year and a half later I'm here telling you all about my experience. I do still think of that man often. I don't remember his name. I don't know what he looked like. I just know our conversations helped us through. Edit. Thank you all for your kind words and awards. parts are harder to come by, and everything is more expensive. How much hearing impaired people were affected? My mother, who wears hearing aids, also depends on reading lips, especially in louder, busier areas. Hearing aids can have trouble sorting through complex noise situations. You can imagine what happened when everyone covered their mouths. Now she's more isolated than ever. Since then, I've ran into a co-worker who is also hearing impaired, but doesn't want to return to office, because while she can read lips on Zoom, she won't be able to if we mask up in person. They were an invisible casualty of this pandemic. Edit. The response to this has been more than I expected. If anyone has links to their favorite organizations to donate to help the hard of hearing, please share them. I hope the stories below help us all be a little more empathetic to each other. Thanks. Children of vulnerable parents with disabilities or immune disorders who are disproportionately affected by long COVID are now acting as carers for their parents, off the books, trying to care for their parents and go to school at the same time. Because of a lack of canvassing and the closure of charity shops in the U.K, children's charities lost millions over the pandemic. Barnardus, for example, lost 65 million. At the same time, up to 31% of children in the UK are now living in poverty, exacerbated by cruel government cuts to services/support. The government are now reducing payments for these families, relying on universal credit by £80 a month, while food and utility prices are skyrocketing. Supply chain shortages. It's contributing to skyrocketing cost of living everywhere. Every time things shut down, it only gets worse. Less cancer and other serious diseases diagnosed and treated. Less needed surgeries performed because of the hospital staff being reassigned to COVID wards. Less referrals written to not overwhelm specialists. In-person health services becoming harder to reach, so less conditions like skin cancer diagnosed. The health of all of us suffers, not only those affected by COVID. This Christmas is going to be a disaster. I work for a major depth store that carries toys and we're expecting to be sold out of everything by like November. Even regular clothes and stuff, we are still waiting on some products to show up from factories that were supposed to arrive in like July. We've basically had 2 years of crippled production across the board, but because of shipping times, we are only really just starting to see it. Do your Christmas shopping now or yesterday. I'm a prosthetist, and I'm not sure people are aware that amputation can happen post-COVID. I work in a small private clinic, and we have about 15 patients who had various levels of amputation secondary to COVID. Would love to know the statistics. The guy that founded Texas Roadhouse killed himself due to extreme tinnitus brought on by COVID-19. People who were furloughed had time to realize they hate their job. I can only speak in service industry, but it feels like a soul-crushing job more than ever. I used to love bartending, and now I feel trapped by it. Everyone I talk to seems to feel the same. The money doesn't seem worth it anymore. Guests are worse and more entitled than ever, and staff shortages have made shifts harder and longer. It has left me with a sense of hopelessness, as it's the only career I've known, but I cannot imagine a future continuing to do it. The work environment has been rather toxic. I work in a company where some people have the option to stay home while others don't, and it has caused some resentment between departments. My memory is trashed. I clicked on a movie in our recent downloads and said, "You wanna watch this?" My hubby was freaked, because apparently we had watched this 2 days prior. He went through it with me scene by scene, but I have no memory of it. I now frequently forget the door code in work. My mum is really going through some stress right now, and I speak to her daily. Sometimes I forget the people she's talking about / entire conversations, and I feel like an awful daughter. Never had a memory issue before. This isn't on purpose, it's only happened since I had COVID, from which I was very ill for about a month, despite being 29 at the time, now 30, but my doctor's response is that nothing can be done because no one is researching the long-term memory effects yet. So I'm just in limbo. Managers give me jobs to do in work, and before I finish one I forget the other thing and everyone thinks I'm an idiot. Having COVID fog isn't a legit thing, yet so most people just think I'm an idiot. I have 2 degrees and I now struggle in a mediocre job. Lost my previous job, where I had responsibility to the pandemic. It sucks. This is gonna be an app history question in 20 years. Old folks getting cut off from their kids and social interactions. I think a lot of them are suffering in silence. Edit. If you haven't spoken to your parents or grandparents in a while, give them a call. A skyrocket in domestic abuse as families are forced inside with one another, coupled with financial issues, or just people being stuck with abusive partners with nowhere to go. I know it's been mentioned, but my high school students are woefully lacking in terms of behavior and meeting social expectations. It's like they have no idea how to function at school. This group has been affected by the pandemic since grade 8, which is when work habits tend to take form. This will take a few years to rebuild. There's going to be a rise in drug and alcohol addiction coming out of this. Guarantee. Dog rescues facing increased pressure as people start to return to work and find their dogs have horrendous separation anxiety due to lack of correct training. My brother who works for DSS said during the pandemic child abuse reports plummeted. Which likely means unfortunately that, rather than there being less abuse, there are less chances for people like teachers having a chance to catch and report the signs. Being single became crushingly lonely, especially if you were already looking for someone. A general decline in people's social skills, especially for the introverted and young children starting schooling during the pandemic.